for injection, we are going to focus on areas of volume loss, so areas of shadowing, really. She's got great cheekbones. She has this nice fat pad right here that's migrated down a little bit, but we can't inject here. We can inject here, so we're gonna start numbing here because this is a very painful spot and we do have to go down to the bone to avoid the artery. I find the rest very actually comfortable, so I don't really numb a whole lot. But the other area that you can numb, although it's one injection, 90 degrees with a deposit, aliquot of like 1 ml slowly. So some people do numb there. I don't find that hurts a whole lot. It's just here in the nasal ala. So, and I do that last. So the other areas of shadowing she has, actually I can mark this out. I need to get better about marking when I'm training. Here. So when I look at her, I just want to find areas of shadowing, and anywhere you would put a traditional filler, you can put Sculptra. Some people have a line here, she doesn't. Here she's starting to get deficient, and this also pulls back. So if we want to give her a mini facelift, really we want to do anything that pulls back. This right here, the pre-jowl area, concentrating really along the bone, and then here again. Obviously she's a little more full here, which is a fat pad that's migrated down a little bit. So in order to define the jaw and kind of smooth this out a little bit, I'm going to go here with an aliquot, and then I'll go up a little bit. She does have some volume loss here, but this is not a sign of aging here. It's when people are hollow here. So for her, I'm not going to inject here. I'm going to bring more volume here and here. Whereas sometimes some people are really sallow and hollow here, or are too hollow here. It's not balanced. And then for her temporal hollowing, I like to sometimes get behind people too, here to here, and then here to here. And then usually the same thing is happening on the other side, but people are always asymmetric. And I like putting the light like that too. So definitely here, smile big. If I was doing traditional filler, I would want to make sure that I don't go, smile big again, relax, that I really, really stay lateral to here, because this is where that fat pad is. And when she smiles, her oris and the rest of her smile muscles pull this up, and I don't want to make her too cheeky. So if I was doing traditional voluma on her, I would actually really, for her, focus right here and out. Whereas some people have a lot of mid-face malar flattening, she doesn't have that. You can see where she's prone to it when I do that and pull down, and she will have that problem as she ages. But right now, that's not the issue. It's really here. Because it's Sculptra, we can do a tiny bit here. Again, she has this nice cheekbone and definition that we like to watch contour videos on and fail on frequently. So I'm going to keep that because I like that. If it was too depressed and looked aging, I would support that, but for her, I don't need to. So I'll do an aliquot here because she's got some fullness here, to balance that out, to pop this out a little bit, and then a little bit here to pop that out a little bit, because she is a little unbalanced in that this is a little bigger than here and she's more narrow here, which is actually good because it's a sign of youth, but we can support the pulling back by adding it in there. And then for here, again, the shadowing. So she's heavy right here. So we want to stay medial to this. We do want to deposit some here, but not here because of the fullness from her fat pad that's migrating down. And then again, the shadow kind of stops there. So, Sculptra is less precise and more artistic, less exact, but more forgiving. So because it's so thin, as long as you're not injecting an aliquot everywhere you go, you're doing more of a thread and fan technique, and mesh if you need to. You'll be fine. You want the squeezy balls?
Sure.
Do you pass out or anything?
No.
Okay. I did not ask. Do you have any thing I need to know about medically?
No.
I normally would not ask on video.
So,
You would stop the video if you needed me to.
Yes.
I trust. Okay. So this can settle out. I just moved it from one area to the other, but before I inject it, I just want to give it a little shake. We should, in theory, have 3 mLs, 3 for each side, but it does get a little uneven. Like this has 4 mLs, this has 3.2, 3.2, 3.2. Well, I have to. So I just want to make sure I'm doing it evenly, unless somebody is dramatically different on either side, and actually that correction would happen with hyaluronic acid. It would not happen with this. So in general, Sculptra, I can't think of very many reasons that you want to inject it pretty evenly. So I like to, so I don't get mixed up, I like to kind of separate them at my workstation. Yeah, so this one has 2 and this one has almost 2, so that's perfect. Again, I'm doing this aliquot last. I usually start with the temples. And I do about 1 ml per temple. If you kind of plunge up and down before you inject, it usually can prevent some of the clogging, but you'll inevitably get clogging. So this is 90 degrees down to bone. And then this is the one that I do tend to aspirate. The molecule is so small and it's so thinly and diluted with, exactly diluted, sorry Olivia, with water that the chance of it occluding a vessel are very small, but. I always tell people, so that's clogged. Sometimes you can plunge it back and forth while it's in the patient, but a lot of times you have to pull it out.